I want to know what is the golden hour in the management of heart disease. We really want to know how we get saved from all of this.
Yes, so anybody knows golden hour? Golden hour, anybody knows what is golden hour? Pardon?
60 से ऊपर वाले जो आज के टाइम पे लोग सर्वाइव कर रहे हैं उसको बोल रहा है गोल्डन एज बोल रहे हैं
Golden years. Golden years नहीं, golden hour. Golden hour. HOUR. R. Anybody?
Come on, you can win a chocolate.
Golden hour is the first hour after the onset of heart attack. So why it is called golden hour? Because if we revive the patient, if we treat the patient within this hour, then the chances of death, they will be minimized, and also the chances of muscle dying or complication occurring will be minimum. So after the golden hour elapses, then more and more muscle keeps on dying, and every minute is crucial. Every minute lost means several days of life are lost. So usually people, they don't reach the hospital within this golden hour, but nowadays people are becoming aware and they try to reach. So what should be the actual protocol is that within 5 minutes your ambulance should arrive at your doorstep, and then your treatment starts from the ambulance itself. So they do the ECG, they flash it to the doctor, and the doctor diagnoses and they start the treatment within the ambulance itself. And by the time you reach the hospital, your treatment is already started, the cath lab is ready, and they wheel you into the cath lab and immediately do the angio and open up the artery. So once the artery is opened up, the muscle is safe, so the chances of complications and death become minimized. So sometimes we are staying in a place which is far off from any cardiac center. So what should we do? Anybody can tell me? If you are away from the cardiac center, it will take more than 1 hour. Some people, suppose Jointa's unit is in Himachal and there is no cardiac center around, and it takes 5 hours for them to reach, and one of the unit person, they have a heart attack. So what would you do?
Yeah, I actually don't know what to do. You should tell me.
Oh, one
Pardon?
thing I want to...
Yes, somebody was answering.
CPR.
CPR is when you get a cardiac arrest. But before that, can you do something? You don't have to wait till you get a cardiac arrest. So the best thing you can do is go to the nearest place, any hospital, any center, and there they can give you a injection which is called thrombolysis, and that injection will dissolve whatever clot is formed inside your artery, and it will give you extra time so that you can be stabilized and sent to the cardiac center. So if you just rush the patient to the center and it will take more than 1 hour, then the chances of dying on the way are very high. So before doing that, first we have to stabilize the patient, give the thrombolysis, and then once the patient is stabilized, then we can refer. So that will give extra hours and extra days for the patient to receive the treatment.
Which also means that we should give way to the ambulance. You know, ये हमारे देश में सबसे बुरी चीज़ है, एम्बुलेंस पीछे बजा रही है सायरन, हम लोगों को होता है हम निकल जाए पहले. That's the worst thing. You know, every time you see an ambulance, please be kind. Please say, I mean, in the West there is a rule, जब कभी भी कोई एम्बुलेंस आती है, every car moves on to the right, so that the left path is, you know, clear for the ambulance to pass. और हमारे देश में 1 घंटे में कैसे पहुँचेंगे जब हम लोग हटते नहीं हैं? So this is like moral duty of all of us. You know, someone's parent, someone's brother, sister, you know, who's out there, right?
And Jointa, आपने ये मेरी ना दुखती रग पे हाथ लगाया, क्योंकि many times when I get a call that there is a patient in the emergency who needs my help immediately, I rush to the hospital and on every light I have to stop और एम्बुलेंस जा रही है. तो I think many times I think that we should train the ambulance driver to do a cardiac surgery, to do the bypass surgery, so that when he reaches the hospital, he can wheel the patient into the operation theatre and do the surgery. Because if we are not able to reach, then who will do the surgery?
We should all raise a word for that, don't you think so? I mean, see, you are the youth, we are the president, right? And we are the people who make the world better. मुझे बहुत टाइम लगता है हम लोग बोलते हैं ये बुरा हो गया वो बुरा हो गया लेकिन करता कौन है हम ही लोग करते हैं it's just us we as people you know we are the ones who behave good or we are the ones who behave bad to the people around us so we are the only ones who are going to bring the change. Am I right?
Yes, many times some patients lose their lives. Once we were calling a cardiologist to put a pacemaker, the patient, temporary pacemaker was suddenly stopped functioning, and that doctor got call from the hospital. Desperately we were calling, and every light was a red light. So that guy took so much time to reach. So that is very sad that if a doctor has to stop at all right, then no point in sending the ambulance. Train the ambulance driver to treat the patient.